Hey, I'm Dr. Michael Lange. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, riceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at Fortifeye.com.
Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So don't be shy, pick up the phones and give us a call. I say us because, of course, my co-host is in the studio with me. That's Dr. Susan Summerton, who's also a certified nutrition specialist, an optometric physician, and a diplomat and a fellow in the nutritional arena. So it's great to have Susan live in the studio, not calling in. Good morning, Susan. Great to have you with me.
Good morning, Dr. Lange and our listeners. Yeah, I drove over here from the Villages and live here in Tampa today. It was a beautiful drive in. Got to look at the bay. There's actually dolphins out there. It's a beautiful sunny day. So we're all ready and welcome your calls and here to answer your questions on this Easter weekend.
And we want to wish everybody a happy and a healthy Easter. And I'm sporting my Easter hat, everybody. There you go. I was going to wear a pink shirt, but I don't know. Me and pink just didn't go well on the TV screen here. So I do have my Easter hat. Anyway, what do we talk about on this program? We talk about anything having to do with nutrition. We talk about anti-aging wellness, nutritional wellness. We certainly talk about eye care and nutrition for the eyes. We talk about ways of supporting the body. And if we make your body healthier, we make your eyes healthier and vice versa. I'm pretty famous for saying that God made a pretty good body. As long as we give it the right fuel, it can perform at optimal levels. And I like to think that we develop and design and research the latest of the latest in nutrition, in the nutritional arena with the Fortifeye Vitamin Supplement Company. Our Fortifeye Vitamin Company is based on the motto, right ingredients, right science, right for you. It's a fully transparent company. We tell you exactly what's in our supplements. We don't give you any crazy, not a proprietary blend, because we're proud of what's in our supplements. So we let you know. We don't trademark these because that's a waste of time. Somebody could create something and put 1 milligram extra or 1 milligram less. So it's hard to trademark supplements. It's kind of a waste of money. Anyway, phone lines are open. Once again, this is a live call-in show, and we're actually good morning, good afternoon, and good evening, just depending on what part of the world you're actually viewing us or listening. So we're coast to coast via the Ask the Doctor network on a multitude of radio stations throughout our great country. We're on a multitude of podcast channels, live video streaming on just about every social media platform. So the phone lines are 813-282-8283. That's 813-282-8283. I still want to welcome, there's still new WRNO in New Orleans, Louisiana. And we're on 3 new stations in Texas. Certainly, we're in Chicago now. We're in Philadelphia. We're all over the place. So there's a lot of new stations that have joined the Ask the Doctor network. You can learn more about Fortifeye vitamins at fortifeye.com. That's Fortifeye. So fortifeye.com, Fortifeye. You can actually order your vitamins at fortifeye.com as well. It's a totally secure site. It ships out of either Ocala, the Villages, or Clearwater, just depending on where you're located. And you usually get it in 1 to 2 days, and it's no charge for shipping. So go to fortifeye.com. I'm going to give you the phone number for Fortifeye vitamins. We are open today on Saturday until 3. That's 866-503-9746. 866-503-9746. This is the Easter weekend, so I will be at the Lange, no, not the Lange Nutrition Center. I won't be there. I'll be at the Fortifeye Nutrition Center from 1 to 3 today. So that's in Clearwater. If you want to come pick my brain on nutrition, Fortifeye Nutrition Center right there on McMillan Booth Road in the Publix Plaza. That's Bayside Bridge Plaza, Publix. Can't miss it. Fortifeye Nutrition Center. I'll be there from 1 to 3 today. This is Easter weekend. So if you hear a tape on this, you'll know it's Easter weekend. If we run this tape, if we're out at a conference, Dr. Summerton and I at a lot of conferences throughout the country during the year, then you'll know that I'm not live. So don't go to the Nutrition Center if you want to see me. But today you can on Easter Saturday. Well, actually, Easter's tomorrow, Sunday, right?
Tomorrow. Happy Easter tomorrow.
Right. And so on the way in, well, actually this morning, Dr. Summerton and Chris, her lovely husband, came over, and we had a breakfast this morning, and it was a high antioxidant packed, high protein. Dr. Summerton's holding it up. That's our new grass-fed whey protein isolate. Well, we got dual screens today. So we got dual screens. I'm holding it up as well. Well, I don't know how to center it like you do. Yep. That's the new whey protein isolate in a clear bottle. Okay. You can see the protein. It's full. It's 30 servings. This is a grass-fed whey protein isolate from American cows. It's non-denatured. It's microfiltered. It's hormone-free, antibiotic-free, gluten-free, soy-free. And we had a scoop of this with 2 cups of A2 cow's milk and organic blueberries, blended it all together. So we had, about 40 grams of protein, plenty of antioxidants, a little bit of carbohydrates from the whole milk and from the blueberries. And it actually tasted pretty good, didn't it, Susan?
It was. It was almost like a blueberry milk, but it's also very filling. I feel very satisfied and energized today for the show.
And you know, most of our patients, when we quiz them and talk to them, what do they have for breakfast?
Well, I know on the way here, when Chris and I were driving, there was a lot of bagel shops that we kept passing by. And I was actually thinking that. I'm like, there's a lot of bagels being eaten this morning, a lot of carbohydrate.
A lot of carbs and not much protein. So think about it. What did you have for breakfast? Okay. A piece of toast and a cup of coffee, some cereal, a cup of coffee, oatmeal, a cup of coffee, a bagel, a cup of coffee. I mean, you got to put protein. Protein in the morning is very important. You need 30, 40 grams of protein right when you wake up. The good thing about whey protein, it's fast acting. Whey protein is the fastest acting. Now, remember, whey protein is also very high in branched chain amino acids that build muscle. That's valine, leucine, and isoleucine. And then essential amino acids that are responsible for muscle building and overall wellness and your immunity. But it's also high in covalent bonded cysteine that converts to glutathione, the master antioxidant in your body. It's high in something called lactoferrin, all right? Lactoferrin is a globular glycoprotein that it boosts your immunity, and it's antimicrobial. CLA actually comes in the fat in milk. It's also in beef, and it increases your immunity and helps you to lose weight. It's high in immunoglobulins, IgA, IgE, IgM. So not only the protein, it's great for your immunity. But remember, most whey proteins are coming from a country that maybe you don't want to buy it from right now. And most whey proteins, the milk is fed genetically modified omega-6. That's pro-inflammatory, not grass. which is anti-inflammatory, and it's heated and destroyed. The delicate immunoglobulins and the immune building properties of whey protein are destroyed because the milk has been heated to over 200 degrees for more than 30 minutes. Once again, our whey protein isolate, the grass-fed whey protein isolate, is heated to only 72 degrees for 15 seconds. That used to be considered a medical food. So all of these immune building properties of the whey remain intact. So we do have it available at fortifeye.com. We've had no unflavored whey protein isolate for about 5 months now. There's been a massive shortage in whey protein. The price has gone through the ceiling, even for bad whey protein. This isn't bad. It's 30 servings for $50 of the best whey protein on the market. If you're on a carnivore diet, you can have this. If you're a ketogenic diet, you can have this. If you're a paleo diet, it's a little iffy, but I think you can have this on a paleo diet also. All right, go to fortifeye.com and click on the whey protein section and get the grass-fed whey protein. We are going to open up the phones now. Dr. Susan Summerton and myself, Dr. Michael Lange, are here to answer any questions regarding your vision and eye care. So give us a call at 813-282-8283. A lot of you are probably out visiting relatives for the Easter weekend, and sometimes we don't get as many calls, but you can help us out at 813-282-8283. You know, we're pretty excited about some new technology that we've actually put into the Lange Eye Institute just recently, and we're finding other treatments that this modality are good for. And today we're going to kind of talk a little bit about dry eye before we get into this. And dry eye is something that plagues all of us at some time or another, right? Dry eye. Patients or you will experience eyes that feel sandy, gritty, burn, tear, itch, fluctuation in vision. Can't wear your contact lenses for a long period of time. And as we get older, our eyes get drier and drier and drier. And oftentimes we approach this first naturally. And since both Dr. Summerton and I are certified nutritional specialists, we like to think that we do a good job of this. And let's talk a little bit about, Dr. Summerton, some of the natural approaches before we elect to do some of these newer procedures that we incorporate in our patients at the Lange Eye Institute.
It did. And it used to be, we used to think people's eyes are dry just because they needed a little bit more water. But we've learned more over time that about 86% of the dry eye cases are what we call meibomian gland dysfunction. And that's along your eyelid. On the bottom and the top, you've got all these little glands called meibomian glands, and they produce oil into your tear film. So every time you blink, a little bit should come, and that stops your tears from evaporating there. So we want to address that naturally with omega-3 fish oil in your diet. It's an essential fatty acid, and that's what's going to help naturally go through those inflammation pathways, reduce that swelling around those glands, and also give it the oil that it needs into your tear film. And that's why people get confused when they come in. They said, my eyes are watering all the time. I don't understand why you're telling me my eyes are dry. They're the opposite. They're watering. Well, that's your body trying to help you out because you're sending the message. Every time you blink, if your tears are evaporating too quickly because you don't have the oil layer, then your nerve endings are going to tell your brain, make more tears, and you get that kind of reflex tearing. So you get that watering. It is actually helping you, because if you didn't get the watering, then we see the more severe dry eye cases where we actually see like these dry, dead cells along the surface of your eye. So we want to make sure we get those glands functioning, good omega-3 fish oil. We help it out with warm compresses, hot enough so you feel the heat, not too hot that you want to pull away for a good 10 minutes. And of course, we like the over-the-counter teardrops, but we're really big on preservative-free. Look for PF, preservative-free. That way, it's not irritating the ocular surface even more. And once you've done those basics, if that works, we're certainly happy with that, but we definitely have a lot more choices that we could go into as well.
Right. So we like to heat them, we clean them, and we nutrify them, and we lubricate them. Those are 4 natural steps. And so a hot washcloth is fine, or you can get something like the Bruder mask or the Optace mask. You put in the microwave for 20 seconds, and this works quite effectively. And then we like Optase tears or Oasis tears. You can get all this at fortifeye.com if you go to the eye care section. So Optase and Oasis we like because they're preservative free. And they also have hyaluronic acid in them, which is kind of a natural anti-inflammatory. It binds to the epithelium, makes a little bit more slippery surface. So it helps dry eye a little bit better than typically the ones you can buy over the counter. So we heat them first. We use the lubricants like Optase or Oasis or a good preservative-free lubricant. And then cleaning the lids. So you can do something as simple as baby shampoo in the shower, or you can use something that's created that's a little bit better that actually kills the microbes, something like a hypochlor solution or a tea tree oil derivative, things like that. On our website are Optase tea tree lid wipes, Oasis hypochlor solution. All of these are good at killing the microbes that are on the lids, and this is called blepharitis. So we want to eliminate the bacterial buildup, even the Demodex mites. That's right. People, a lot of you have mites crawling around in your eyelashes, and they crawl in the hair follicles and the meibomian glands. They lay eggs, and they clog those. So heat them first, then kill them with the Optase tea tree oil lid wipes or the hypochlor solution. And like Dr. Summerton said, nutrification of the glands is good. A good reesterified triglyceride form omega-3. Of course, we're a little bit biased. Fortifeye Super Omega. If you're under 200 pounds, Fortifeye Super Omega-3 Max. If you're over 200 pounds. And also, we're going to talk about something called IPL in a minute. And after you do your Opti Light, your Lumenis Opti Light IPL, it stands for Intense Pulse Light Therapy, taking the omega-3 and still doing lid hygiene, heating them and keeping them clean, will ultimately, hopefully, keep those glands open so they don't get clogged, and you don't have to have numerous procedures called IPL. But it doesn't hurt. It's a quick procedure. We're going to dive into that and talk a lot more about that in just a minute. So check out those things at fortifeye.com, FORTIFEYE. And we're getting ready to take some calls here in just a second. The phone number is 813-282-8283. Before we take the next call, I just want to also mention something that is really underutilized in a lot of clinics, Dr. Summerton, that is very simple to do. It's covered by Medicare. It's covered by people's insurance, is helping the tears stay on the cornea a lot longer with punctal occlusion. Painless, makes the patient happy. Very effective, isn't it?
It is. And we do that every week in our clinic, the punctal plugs. And again, people get a little nervous when they hear that word, but it is painless. There's no restrictions after we do it. We do it right there in the office. It's only takes a couple minutes per eye. And again, right along the lid, you have a natural little hole right there in the corner by your nose. We'll make that just a little tiny bit bigger so we can fit it in, and we place it. We put a little numbing there, but it doesn't hurt. And we place it right in that natural hole, and it holds your tears in there longer. So basically, if you're not making enough tears and you're draining too much, it's kind of like a little plumbing problem. You want to equalize the amount that you're making to the amount that you're draining, and then your own natural tears stay on the surface longer. And that's that protective barrier of that eye that is an exposed organ all day.
That's right. Punctal occlusion. Talk to your local optometrist or your ophthalmologist. If you have dry eye and you've tried all the other things we've discussed, talk to them about punctal occlusion. In just a few minutes, we're going to talk about some stem cell amniotic infused membranes. We're going to talk about IPL, Lumenis Opti Light, Intense Pulse Light Therapy, and we're going to talk a little bit maybe about Luminous Opti Lift as well. But we're going to go to the phones. Let's see. Steve in Clearwater. Good morning, Steve. Welcome to the program.
I was just thinking, how cats get ear mites? Okay. Well, Demodex is a mite. Is that correct?
Right. And it causes mange.
Right. Well, the way that the anti-flea and tick medication works in dogs and cats is it's a long half-life. It lasts 6 weeks. And it should be able, I would think if you're a landscaper or someone that's around mites or something, it works by a mechanism with a neurotransmitter that humans don't have. So you could probably take 20 or 30 tablets of flea tablets and it wouldn't even affect you. because you don't have the transmitter system that the insect does to work through. So I'm wondering if they could invent a pill which would work similar to what flea and mite medication in dogs and cats.
Wow. So people that are listening to Steve, do not take your dog's flea medication, please. But maybe you could try the flea collar.
Well, there's, I'm not saying that they should do that. We
Right.
don't know in humans what it would
Sure.
do or if it would be toxic, but it's certainly something that could be researched.
Well, you bring up a really interesting point as far as a pill you take a day, but Dr. Summerton is somewhat of an expert because she's done more than me of a special drop, believe it or not, that actually kills the mites. I can't even think of the name of that drop.
That's Zemdevi.
Zemdevi.
Yeah, it is. And we do that. You have to do it through the whole cycle of the mites because they do actually lay eggs on the eyelashes. They crawl around there at night. They do their little mating thing and they lay eggs. I know it's a lot to take in when you think about it. We unfortunately do see it quite commonly, but we do have a way of getting rid of it. The Zemdevi is one of the ways of doing it. It's a little hard to come by. It's one of those that it gets hard to cover for insurance, but we use it 1 drop twice a day for a full 6-week cycle. But then we do also have to use the tea tree wipes because you're going to have all those little exoskeletons come off and all that dead debris that sometimes you can get a little reaction to all the dead stuff. So we got to use the tea tree wipes too. But what we're going to talk about, the IPL is a fantastic way of just during that treatment for dry eye. It also takes care of any of those little Demodex mites as well.
It disintegrates those bad boys and it disinfects everything. It kills all the bacteria, the viruses, and blows the Demodex to smithereens because it's called IPL, Intense Pulse Light Therapy, and Luminous Opti Light is the only one FDA approved for dry eye treatment. And the Lange Eye Institute in the Villages, Florida, we have the only Luminous Opti Light that's FDA approved for dry eye treatment and the treatment and the death of Demodex mites.
What if you swam in chlorinated water?
Well, I think chlorine will definitely kill Demodex, but I don't think it's a high enough concentration in the swimming pool to kill them. Chlorine kills just about anything, as you know. But I don't recommend people putting chlorine on their eyelids because it would burn and it would cause edema and swelling, and you would be in the doctor's office saying, "Ouch."
Well, yeah, I agree, and like I said, I'm not recommending that people take flea medication, but it is something that I think that they ought to be researched.
Right. They could definitely have something that we could take orally, like animals do, like you mentioned. That would be simple because when you think about it, compliance can be a big issue. Think about our patients that have rheumatoid arthritis and their knuckles are all curled under. They can't put these drops that Dr. Summerton was mentioning.
Right.
They can't even do lid scrubs. So an oral pill would be good. So maybe some of the big pharma companies are working on, they're listening right now. It could be, multi-million-dollar. Maybe we all need to get a little royalty from that.
Well, they do have good old ivermectin does kill the Demodex mites if you take that orally as well. That was kind of the old school treatment for it too.
Right, ivermectin.
Mm-hmm.
And one thing, you spoke of rheumatoid arthritis. If you're on a good nutritional supplement and it suppresses that, can you get repair? Can that be reversed, or is the damage done?
It depends on how bad the RA is. My dad was a rheumatologist, so I dealt with all of his patients when I was practicing in New Orleans. And, it's an inflammatory disease where it causes inflammation of the joints. There are definitely supplements and diets, like the Lange Survival Diet, which is an anti-inflammatory diet, and taking certain supplements like the Fortifeye Super Omega, the Next Gen Curcumin, the GLA, our collagen, our Rejuvenate. These things can help with inflammatory processes and lower inflammatory markers in the blood. And thus, people like myself, I've broken just about every bone in my body from racing. I've got some degenerative arthritis all over my body. And these supplements do help. I mean, I have my mom, 97, obviously she has some arthritis. So these supplements absolutely can help with some of the symptomology and help with some of the swelling with autoimmune diseases like rheumatoid arthritis. My daughter has a lot of health issues also, and she's a world-class athlete, but she got it during the pandemic, she somehow caught some autoimmunes, and she's on these supplements, and it really has helped her thrive instead of just survive. But, rheumatologist is a godsend. Rheumatologists are amazing because when nobody can figure it out, they're there to figure out what's going on. And we oftentimes have to use certain types of medications if it gets bad enough. I mean, things like corticosteroids, methotrexate, Plaquenil, hydroxychloroquine, all of these things can be beneficial to patients that have rheumatoid arthritis. But also weight management is crucial. Remember, because if we're overweight, we got a lot more inflammation in our body, and we're carrying a lot more weight on our joints. So every pound you're overweight, it's 4 pounds at your knees and 6 pounds at your ankles. So think about it. If you're 50 pounds overweight, that's 200 pounds you're carrying around on your knees every day. So one of the best things we preach about in this show for anti-aging and wellness, no matter what the health problem is weight management, getting down to your ideal body weight. And of course, we love doing it as naturally as possible, but there is a place for pharmacology in medicine today. Absolutely. It's hard to do everything naturally. So sometimes we do have to prescribe medications, and sometimes we do have to have surgical intervention as well.
Right. And one real quick question on the GLP-1, what do you call them, antagonists or agonists, or I forgot what they are.
Agonists.
Okay. What percentage of the people that are on them right now, and I know this is just something you have to pull out of your hat, what percentage of the people that are on them right now have to be on them and couldn't be doing it on their own with diet management? I mean, it just seems to me that everybody and their sister and their brother is on this stuff. And I just don't think, if you're grossly overweight, I'd understand it. But I don't understand why so many people that have to lose 2 pounds are on this stuff.
Well, I'm going to let Dr. Summerton chime in. She's somewhat of an expert in this arena versus me. But if there's a will, there's a way, Steve. All right. Some people that are overweight, they got there. It's not their genetics. Okay. They got there because they ate too much and didn't exercise enough. Remember, a pound is 3,500 calories. The way you lose a pound, you consume less calories and you burn more calories, and you will lose weight. I guarantee. Okay. We help people lose weight all the time. I've got friends of mine and patients of mine that have lost 200 pounds in, 2 years, 100 pounds a year, naturally without a GLP-1 receptor drug. But in today's society, people are lazy. People want a quick fix. And drugs are the name of the game. These GLP-1 receptor drugs do help you lose weight. They curb your appetite. You eat a lot less, and therefore you have a lot of problems. If you're eating a lot less food, you're not developing muscle. You're not getting enough protein. So you get sarcopenia, muscle wasting. You can get bone loss. You can develop ischemic optic neuropathy and literally go blind. There's a lot of side effects from GLP-1 receptor drugs, and that's why you shouldn't willy-nilly pass the needle around with your friends. You should only be prescribed by the doctor, monitored by the doctor. But people do benefit. People that are dramatically overweight, Dr. Summerton, and have not been able to do it naturally on their own for whatever reason, they do benefit from these GLP-1 receptor drugs.
They do, and they do have the benefits. And I would say, you're talking about people lose weight. I would say everyone that's on it has tried to lose weight naturally. I can't imagine there's a person out there that hasn't tried on their own to lose weight. But they are discovering many, many more benefits to the GLP because we do naturally make them in the gut. And that's part of the problem. Some people can't make as much in their gut. So when you start off with something like semaglutide, that's Ozempic. That actually is 80% natural. All they've done is extend the life of it, because normally we make it when we eat, but then it breaks down so quick. All peptides break down very fast. So they just make it last longer in your gut. But that does slow the digestion down. So you have to be careful in what you're eating. You can't eat fatty food. You still have to eat healthy. You still have to eat the good food. And so we make sure on the GLP receptors, it's not a free pass. It's an aid to help you. It does help lower the blood glucose too for the diabetics. And everyone, if we can get that glucose response down, we're helping the health. So a lot of it is not high dosing as well. Reducing your appetite is a side effect of it. So if you go too high, you knock out all the appetite. We don't want to knock out all the appetite. We just want to kind of gauge it more naturally on those lower doses. So There's anti-inflammatory benefits. There's brain benefits to these GLPs now because it is a natural substance. They've just extended it. Of course, they're going a little further by extending with the tirzepatide that affects another receptor. Now they have retroglutide they're studying. That's another third receptor. So they're adding on to actually increase fat metabolism with this new one, retroglutide. So it's an interesting one that's going to be coming out. It's in research right now.
All right,
Well,
Steve.
yeah. One final comment. You guys see things that other people don't see. What is the reason that you guys are able to see beyond what most people in the business see? It's like you have a special gift to see beyond what most people see. I don't understand it. What did God give you that a lot of other people in the profession?
That's a good question. We're special.
I think you are. I'm serious.
I think we're just nerds and we like to read a lot.
It's a lot. You know, we've been doing this talk radio for a long time, Steve, and we are constantly researching. I mean, that's why I don't sleep. You know, sometimes I go to bed 3, 4 in the morning and I get up at 6 because we're constantly, you know, evolving our continuing education, reading, learning. You know, since we own a vitamin company, Fortifeye Vitamins, we want to develop the best for our patients. So we're constantly learning. Like I said, our supplements are constantly evolving based on what we learn. So life is a learning process. I tell you, the day we go to the grave, when we're 110, we're going to be pretty smart.
Okay. God bless you.
Thanks, Steve. All right, we're getting ready to go to the next call. I think Natasha's been holding. Good morning, Natasha. Welcome to the program.
Good morning. Happy Saturday to both of you.
Thank you.
You too, Natasha.
You're welcome. So I have a quick question for you. I have been working out a little bit more recently in the past month or so, and I do use FitPro and Rejuvenate. I use both of those. I recently increased my scoops on my FitPro from 1 scoop to 2. I've noticed like a big difference in my weightlifting and my energy levels, my stamina. So I'm 100% sure I want to stay at the gym like all day. But what I don't want to do, and this is maybe more of a question for Dr. Summerton, what I don't really want to do is I don't want to bulk up because that's kind of in my nature, like as far as my build. I want to kind of make it to where it's more of a lean muscle rather than a bulky muscle. With the FitPro and the Rejuvenate that I've already incorporated, what would you suggest? Is there anything else that I can do, or what would be like the best way to combat bulking up but still being able to use those same products?
Well, I'm going to chime in, but then Dr. Summerton is going to chime in. Her being female and being athletic has definitely got some good news on this. But I'm glad you're taking the 2 scoops, because when we really developed FitPro, it was made to take before you work out, about 30 minutes before you work out, and then again right after you work out, and then add either a scoop of our whey protein isolate or our super protein or even the vegan super protein. Add a scoop of one of our proteins right after you work out, so you're getting additional protein. So when you take 2 scoops, you're getting the therapeutic, clinically studied amounts of the German Creapure creatine, the MyHMB, all right, the peak ATP, the betaine anhydrous, the L-citrulline, everything that has been shown in clinical studies to be effective at not only building muscle, but losing weight. So remember, FitPro is not only for building muscle, but it's for losing body fat. It will help you become more defined, not larger muscularly, okay? You'll get tighter and you'll lose body fat. The studies show with the HMB at the 2 scoops in the FitPro, you can lose actually 210% more body fat than a placebo, okay? And then 250% more muscle mass than a placebo. So it'll help you build muscle and lose fat. You as a female, you have a lot of estrogen, progesterone, less testosterone. Unless you're taking anabolic steroids or you're taking testosterone injections, you're not going to get hugely bulked from working out. You're going to actually get much more defined, more ripped, and look even better walking down the beach in your bikini. I'm going to let Dr. Summerton chime in.
And he's right. And I know, Natasha, working full time, having a family, it is really hard for these women who do bulk up. They spend hours and hours and hours in the gym. You can ask the bodybuilders how difficult it is to get bulky. So what we're looking at is just health. You know, you spend the time in the gym to activate the muscle, and the muscle is an organ. We know if you have higher muscle mass, you are going to live longer. It's going to help you metabolize. It's going to help you process that glucose. It's going to help you move, prevent fall. And that's the kind of muscle that we're looking for. We're not looking right now, you're not competing in any, but they know when you are competing, you're spending basically all day in the gym with an extremely super high protein diet to get that way. So I wouldn't let that concern you. I would just go do your strength exercises, get your cardio in, and listen to your body, you know, when you've overdone it. And so you take those little breaks. But the main ingredient, especially with women, we're looking at is that leucine that's in the whey protein. And that's one of the beautiful things of that whey protein. After you get that leucine that continues that protein synthesis after, without the extra added calories, because to get the amount of leucine that you need in other foods, you end up having a ton of calories in it too. So we want to keep with that weight loss in mind and those calorie content too.
And Natasha, also remember, recovery is crucial. You got to get a good night's sleep. You got to hydrate. And I would work out on a split routine. A lot of people I see in the gym, and we're in the gym every day, a lot of people in the gym, they're working out every body part every day. They're tearing down their muscle.
Right.
So the split routine I like, and I mix it up a lot of times, but here's a good split routine. On Monday, you do push. That means you do triceps and chest. On Tuesday, you do pull. So you do back and biceps. On Wednesday, you do legs and shoulders and abs. Then on Thursday, you go back to doing, you know, your push, your triceps and your biceps. So it's a push-pull routine. You hit every body part twice a week, and then you can take Sunday off or take one day off a week. But if you only train each body part twice a week, then you're not going to overtrain, especially if you're using the nutrients that are in the Fortifeye Fit Pro and our grass-fed non-denatured whey isolate. And then if you really are serious, and you know, we've got a lot of world-class athletes that are on our Fortifeye supplements. Now they're taking the new vegan super protein at bedtime, 2 scoops. Now it depends on your weight, but 2 scoops at bedtime would be 42 grams of protein. And remember, the vegan protein is a slow-acting, long-acting, where whey protein is fast-acting. So whey protein right after you work out, but the vegan protein that we make, and remember, this is all made in North America, when you go to bed. And then that increases muscle synthesis while you're sleeping, protein muscle synthesis. And a lot of people that are just finding they're at a stopping point where they're not making those gains. A lot of my patients, they've been in the gym for 25 years or longer, and they just plateaued off. Well, when they add this vegan protein, especially the bigger ones, at 2 scoops right at bedtime, they notice they're starting to make gains, even at 70, 75, 80 years of age. So protein is so important. And everybody on a GLP-1 receptor agonist or receptor drug, you know, adding protein like our whey protein, our vegan protein, our Fit Pro in conjunction with these GLP-1 receptor drugs is very advantageous at helping you reduce the muscle loss. And this is very low calorie, so not decreasing the fat loss.
So I am 164 pounds.
All right.
So what would you suggest as far as the vegan? And I've probably been about 160 to 164 for about 5 or 6 months. Even working out, I've not really fluctuated too much. So as far as the protein before bed, because I do also have the vegan I do have the vegan super protein, or the vegan protein, excuse me. What would I do the 2 scoops or the 1 scoop?
How tall are you?
I'm 5'4".
Okay. So I would take 1 scoop. I don't think you need 2 scoops at 150 pounds. 1 scoop at bedtime with water, just water. Shake it up and drink it down right before you go to bed. And then let us know how you're doing.
Okay. Awesome. Well, thank you guys so much. I hope you have the most amazing day on purpose.
All right, Natasha, you have a good one. All right, you're listening to Ask the Doctors. I'm Dr. Michael Lange and my co-host, Dr. Susan Summerton. We're in the Salem Media Studios here in beautiful Tampa Bay. If you've got a question, give us a call. It's 813-282-8283. That's 813-282-8283. Venetia is manning the phones and AJ is manning the ship. So they're doing a bang-up job. One more time, if you got a question, 813-282-8283. 8283. So we started off the show talking a little bit about dry eye, some natural approaches to dry eye. We talked about, heating, cleaning, lubricating, and nutrifying. And we talked a little bit about punctal occlusion or punctal plugs. Now, let's say we've got a patient that has really significant dry eye still, and they got a keratitis, really dry spots all over their cornea, and they have really good insurance, all right? They have Medicare, and they have some pain in their eyes. Now we also have something that we can put on that's covered, that's called an amniotic membrane. And we've had some amazing success with this. And we stock a multitude of different brands and different sizes because it's not one fit all procedure. So this has really been a godsend over the last few years for our dry eye population, hasn't it?
It has. And it's basically like putting a contact in your eye. And depending on what we're doing, we either put it in, we lay it on your eye, and we put either a bandage contact, or we just have to tape your eyelid shut so it doesn't fall out for either 24 or 48 hours. So it's pretty effective in a short amount of time. And that allows the stem cell action of anti-inflammatory and rejuvenation on that surface. It's touching where the problem is, right on the cornea, and allows that to just remarkably heal. And my favorite thing is seeing when we take either the bandage contact lens out or we unpatch the eye to see how much better that cornea surface looks. And not only does it feel better, the patient, they see better because now they have that smooth, clear surface they can look through, and they get their vision back again too. And it's quick. It's also natural because it is the amniotic membrane tested, no contaminants. It's very clean, and patients really appreciate the feeling after.
It is covered by most insurances. So that's a win-win situation. So one of the most exciting things to hit the eye care arena we're getting ready to talk about. I mean, literally, it has gotten me just totally rejuvenated. And speaking of rejuvenation, check out Fortifeye Rejuvenate when you get a chance. But it's called Lumenis Opti Light, all right? The Lumenis Opti Light is a very expensive piece of super sophisticated technology that uses IPL, intense pulse light therapy. And, this has been really a godsend to eye care, both optometry and ophthalmology, because now we have a non-surgical, non-invasive, painless way to really help our dry eye population, not just a little bit, dramatically. I mean, we've tried everything, all right? We used to do LipiFlow. We've done iLux. We do thermal one touch. We've tried everything. We do the natural arena. We do, the amniotic membranes, the punctal plug. So let's say you've tried everything and you still have dry eye, or you don't want to waste your time doing all that, and you want to just jump to which is rapidly, in my opinion, becoming the gold standard for dry eye treatment if you have meibomian gland dysfunction. Once again, it's called Lumenis Opti Light. I'm going to hold up a little brochure. You can see Luminous, all right? This is a brochure for Lumenis Opti Lift, but it's Opti Light is what we're talking about right now. And it uses frequencies of light, all right, that are painless. It's a bright flash, all right? And we do a test spot on your skin before we actually do the procedure. We have you fill out a questionnaire. We analyze your skin to determine what skin tone you have so we can determine what filter to use. So it's a process, but it works. All right. I did probably 15 or 20 this last week to 10 days, and it's a 4-time treatment. So the actual treatment takes the doctor about 10 minutes. Okay. The girls are in there getting you warmed up for us. They put a little gel on your face. They lay you back. They put some soothing music on. Every now and then people want Guns N' Roses though. So we can put rock on if you would prefer. And it's like a spa setting. And what happens is before we have you in for the IPL, during the examination, we push on your meibomian glands, push on the lower and upper lids to see if any secretions come out. If they're really clogged and nothing comes out, or it's a very murky fluid, or it's kind of cottage cheesy, toothpastey, then you're going to benefit dramatically from this, especially if you're symptomatic. So then we go into a room and we do something called meibomianography, where we actually analyze the meibomian glands, and we can see how good or how bad your meibomian glands are. And then we make the recommendation of the IPL. But I got to tell you, this is the hottest thing in the eye care industry, in my personal opinion. We have it at the Lange Eye Institute. Like I said, it's painless, it's non-surgical, non-invasive. It's not that expensive. It's also not that inexpensive. It's $1,600 for 4 treatments, all right? The doctor will be in there with you and the staff for 30 minutes. So it's $400 a treatment, basically. It is not covered by insurance. But if you're one of those people that are having some problems, this is a problem solver. What do you think, Dr. Summerton?
It is. And like you mentioned, we are constantly looking for how we can improve because we have still patients where we've done the basics, we've taken through all the treatments, and they're just quite not there yet. And so now we have another option of getting to that root cause, getting to that inflammation that's in those meibomian glands. And like I said, 86% of dry eye is that meibomian gland disease. So it is the majority of people that are experiencing that gritty, burny, fluctuation in vision, redness. And we know you're pretty miserable if you have dry eye, and we want to help you get through your day feeling better and seeing better. And so this is non-invasive. It is light. And so there isn't any downtime. It is a spa treatment. A lot of ladies and men, they're probably used to, if you get those spa treatments, there's downtime, you're red. This may be a little redness on some people. We ask you put sunscreen under your eyes after. But other than that, you go on your day and your eyes, each treatment is additive. So the first time you feel a little bit better, second time even more. And by the 4th time, that's when you really get those glands working. And it does get your dry eye just improve dramatically.
And you can come to the Lange Eye Institute for that. The Lange Eye Institute is in the Villages, Florida, right on 466 and County Road 101. It's a large plantation-looking building. We have a state-of-the-art center in there, a lot of examination rooms and treatment rooms. We have all the equipment and the technology necessary, and our doctors and staff are trained as good as anybody in the world. The phone number for the Lange Eye Institute is 352-753-4014. So if you want to see Dr. Susan Summerton for an IPL treatment or myself, you're going to call 352-753-4014. So another condition that kind of goes hand in hand with people that do have meibomian gland dysfunction or people that have rosacea or acne are more prone to developing styes. The medical term is hordeolums or chalazions. And so hordeolums, oftentimes we treat with oral antibiotics, hot compresses, topical antibiotics, topical corticosteroids, massage. But these things oftentimes turn into a really impacted, hardened, big lump on your eyelid margin called a chalazion. And oftentimes, no matter what we do, these don't get better. So we used to be effective treatment injecting a shot of Kinalog, a steroid into it, or surgical intervention, cutting that bad boy out. But now we don't have to do that. And we've been doing it. Dr. Summerton, more than me, have been treating chalazions with the IPL. Once again, a painless way to get rid of this big old lump on your lid margin. I watched you do one yesterday, and the patient did really well.
It is. And that's when you, on your lid, you have that little kind of bump there. We do still get rid of the infection with the antibiotic, but it's not pretty to have that little bump left. And a lot of people struggle with that. Not only is it cosmetically affecting you, but functionally your eyelids are not blinking properly left with that. And so we use, again, this light therapy. You feel a little bit of heat when we're doing it, and it starts working immediately so that we don't have to send you to the oculoplastic surgeon and make incisions in your eyelids that thus can leave a scar. Again, we're getting to the naturally and helping your body get rid of that inflammation and heal itself.
Right. And so those of you that are listening all over the country, you can go to luminous.com. Luminous is the company, and you can go to their website. I think it's luminous.com. It might be something else. Just Google Luminous. And they got a doctor locator on there for your city and state. So if you're in the Villages, there's not many of these in Florida, but if you're in the Villages, you can certainly come to the Lange Eye Institute. If you're, anywhere around the Villages, Tampa, Clearwater, Ocala, Gainesville, come to the Lange Eye Institute. And the phone number for the Lange Eye Institute, if you'd like to set up an appointment for an eye exam or to see if you're a candidate for the Lumenis Opti Light and the new Lumenis Opti Lift that we don't have time to talk about, but the Lumenis Opti Lift in conjunction with the Opti Light even works better for dry eye. We'll expand on that in another week or two. But the phone number for the Lange Eye Institute is 352-753-4014. That's 352-753-4014. Also, the phone number for Fortifeye Vitamins is 866-503-9746. 866-503-9746. Remember, the new Fortifeye grass-fed whey protein isolate that is unflavored is now in, and you can order it on the website. Well, we got 44 seconds, and I'm sitting across from you. You got plenty of time to tell everybody goodbye, Dr. Summerton.
Well, I want to wish everybody a happy Easter tomorrow. It's a day for eggs, which eggs are great for you. Enjoy finding those Easter eggs and eating those Easter eggs, and Easter blessings to everyone out there.
Right. Eggs are a great source of protein and amino acids. It's a power food. Remember, everybody needs more protein, especially for breakfast. With that, I'm Dr. Michael Lange. I want to thank everybody for tuning in and listening to Ask the Doctor, and certainly have a blessed Easter weekend. And I'm out of here. Have a great day. God bless you, and God bless America.